Okay, well, why don't we go ahead and get started? I'm Marcy Gallagher with Mountain Pacific, and welcome to our Journey of Recovery webinar series. So just a reminder that this webinar is being recorded, so please keep your line muted unless you're speaking, and feel free to also use the chat to comment or ask questions. Maynette, go ahead and advance to the next slide. I wanted to begin by sharing this definition from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. Next slide. So the goal of the series is to have our speakers share their recovery experience and challenges, as well as speak to their recovery services and programs offered by their respective organizations, and also to focus on collaboration and breaking down silos. Next slide, please. We were excited today to have Cierra Coon, a certified behavioral health peer support specialist, talk to us today about her journey and the great recovery-oriented work being done at Never Alone Recovery Support Services. So at this time, I'm going to turn it over to Cierra.
Thanks, Marcy. Hi, everyone. My name is Cierra. Like Marcy said, I am a certified behavioral health peer support specialist under the state of Montana. Aside from that, I am also a recovering addict. I spent 12 years in opiate addiction before ultimately surrendering my disease to a power greater than myself. And recovery looks different for everyone. Everyone's recovery journey looks different. The pathways that they take looks different. And it took me a long time to find a program that really worked for me. I have now been in sustained recovery for 2.5 years. That came after multiple overdoses, another stint in treatment, drug court, and all these different things that I really had to dedicate my life to in order to get to where I am today. Never Alone Recovery Support Services is actually the program that I found my recovery in. I came up through the program ultimately before becoming a staff member. I think the thing that I found different with this program was it's community centered, meaning we use a social model. And that was the one thing that I was struggling with in order to maintain my recovery. Was I could get clean all these different times, but I struggled with building connections with other individuals in the community because of guilt, shame, and the stigma around addiction and people as addicts. And so in this program, I found that the more I put myself out there with people like me, the more connections I could build. And it really taught me how to form healthy relationships with individuals that ultimately led to my sustained recovery. All of our staff here has come up through the program, which I think is great. So I think now we will discuss what we are, what we do, the things that we offer. If you could go to the next slide. So Never Alone Recovery Support Services, acronym NARSS. We are located in Pablo, Montana, on the Flathead Indian Reservation. Pictured, we have some of our staff and just important people in our community that are involved. Next slide, please. So who are we? We are a recovery community organization, a nonprofit. We provide non-clinical recovery support services. So when I say non-clinical, I mean we don't have clinical treatment services. We also have recovery residence programs, community drop-in centers. Like I said earlier, we use the social learning model, which basically means that we are ran by our peers. Yes, we are staff, but our peers get to create their own programs within NARSS and within the community and really develop their own unique treatment. You could go to the next slide, please. So what we do is we provide a safe, positive, peer-led, peer-driven, empowering person-centered environment. We also support all recovery pathways. However, this does look a little different. If you are in our residential programs, it's complete abstinence unless you are on medication provided by your medical provider. So like harm reduction, right? Some people include marijuana as a harm reduction. We don't allow that in our residential programs. We do allow MAT, medicated or medication assisted treatment, things like that. We also really try to steer away from the stigma that people place on MAT and ADHD medications. You know, there's a lot of people that have biases of, well, if you're giving an individual who is abusing meth a stimulant, you're just substituting one substance for the other. We don't agree with that. If it is prescribed to you, you are more than willing to take it and still be a resident in the program. If you could go to the next slide, please. So what we offer, I'm going to dig a little bit deeper into these. So one-on-one peer support looks different in different organizations. We do not bill Medicaid. We are grant funded through the state, and we are working on a federal grant to pay employers. So what our one-on-one peer support looks like is helping an individual set goals, face challenges, and restructure their thinking in a positive way that can help them reach their ultimate goal of life, right? We currently have 4 certified peers on staff and 1 in training. And so what I do as a peer support here is I'm the lead peer, which means every participant that comes into our drop-in center and is moving either into our residential program or is just seeking services, I sit down with them and I go over this process of learning who they are, what they want to do, and I really try to match them with the best person that I think could benefit them in the most positive way. While doing so, we also do different kind of assessments, like we do a MERC, a multi-dimensional inventory capital assessment to kind of see where they're at and what areas we need to work on. We also offer recovery support groups. This kind of looks different because we're not clinical. mostly our peers try to run these groups. That way they can really build that connection with other individuals in the programs, right? And because we live on the reservation, we try to implement as much culture into our groups as possible. So we do Wellbriety. We have a intervention program called Walking in Balance that was created for individuals within the Cherokee Nation in Oklahoma. However, the way the program is set up is that we can put anyone's culture into the language, right? Whether you're pagan, Native American, African American, any of your culture, right? You can implement into this program, into the language. And then we also do arts and crafts with that to really bring out that culture within you, while teaching about spiritual principles within that culture. We also do parenting classes and anger management and things like that. Um, really just to teach you new tools, right? It's important to have these tools in order to maintain recovery. So if you're struggling, you have this toolbox that you can go back and utilize. We also connect to community resources, which looks like we have individuals that come in struggling with domestic violence situations, and we're able to collaborate with the other program, Safe Harbor, in our area, and get them into a safe spot and get them connected with, Medicaid resources and housing resources and all these different things. Our recovery residences look a little bit different. We are RAM certified under the National Alliance. So our programs have really grown in the last year. When I came up through the program, we had a men's house that housed 8 men, and we had a women's house that housed 6 women. Now we have an 8-person women's house, a 6-person women's and children's house for women who are in reunification with their children. We just opened a new men's house that houses 8 men, and we have a 28-unit city block of apartment complexes for tribal affiliated families. Those units kind of differ. We have roommate units that are gender specific, and then we have a couple units for families. We are also in the process of turning 3 of those units into a 3.3 treatment, where we are in collaboration with an organization in Great Falls. And we're opening this 3.3 so that our clients who are coming out of treatment are actually going in the correct order of like a warm handoff, direct level of care. So they'll go from a 3.5 to a 3.3 to a 3.1, and then ultimately into one of our other units. Our drop-in centers are located in Pablo. Our drop-in centers are, the busyness varies. Some days we have a lot of individuals who are struggling with homelessness and addiction who come in and just want to sit down and talk about recovery and kind of get an idea of what that might look like for them. Other times, they just come in and just want to have a cup of coffee. They don't want to talk to anyone. They just needed a warm and safe place to go, so we provide them that safe place. Connection to recovery support. So this looks like getting individuals in touch with other recovery support networks, right? We are in collaboration with multiple different recovery providers in our area and in other areas across the state. If they don't feel like they can stay in this location, we get them connected in a location where they do feel like they could actually maintain their recovery. And we also hold space for 12-step meetings, AA, NA, well-variety meetings, talking circles. We have a cultural drumming group going on, and things like that. We also do a community garden where our participants can come and learn how to do horticultural therapy, which is, gardening and getting in touch with nature. We are getting ready to put in a drying meat rack, which is really nice for the individuals who really are getting in touch with their culture again. If you could go to the next slide. So that pretty much sums up our program. We have a lot of things in the works, but we're not sure exactly what direction that looks like at this time. If any of you have questions, please feel free to, ask. I know there is a QR code on the next slide for, how we did and things like that. So thank you guys for taking the time to listen.
Thanks so much, Cierra. Has anybody had any questions for Cierra?
Sorry. This is Sarah. I was wondering when I was listening, you were talking about culturally specific practices. Did you find that that is kind of how you connected to the NARSS program?
When I came into the program, I didn't know what culture meant. My family didn't have family traditions or traditions passed down from our history, I guess. Um, so I got to learn about that in the program, right? I got to learn that recovery is a culture. I got to learn that I am a part of a culture when I'm a student, right? I have found that the Native American culture I am able to connect with in a manner that I didn't realize I would because I'm not Native. So I wasn't sure what that looked like, but I found that I can implement their traditions into my life, and I have filled a void that I was missing. If that made any kind of sense to you.
Oh, yeah, definitely. I just thought that was a really cool thing that you talked about where you could, integrate someone's culture and any culture in how you conduct like the recovery process there and trying to get into recovery.
Yes, thank you.
Any other questions for Cierra? Here, I have a question. Tell me what entails becoming a certified behavioral health peer support specialist? What's the process that you have to go through to become certified?
Oh, goodness. That process took me a little while. Um, so their first requirement is that you have if you are an addict, you have to have 2 sustained years of recovery before you can apply. And then you need to go through a 40-hour class. It's called Peer Support 101. They offer it online and in person. And you have to pass that class in order to move on to the application process. The application process is a little difficult. So you take your training, you complete that, you pass that class, you fill out a basic kind of application form, and then they break that application form into different sections. So what I had to do was I had to prove that I had a diagnosis of substance use disorder and or mental health. I had to show evidence that I was in remission. I had to get my 10-year criminal history from every county, every state I had ever been in trouble in. And then using that, I had to go through and I had to give a description as to why I got that charge, what happened after I got that charge. I had to show proof that I was either on or off probation, that I had completed it, or whether my probation officer was okay with it. I had to get a clinical supervisor that was willing to take me on. I had to submit my fingerprints to the state of Montana. And then I also had to pay a $250 fee, application fee. If you are going to get certified, I would suggest getting your fingerprints done prior to filing the application, and I would get started on your 10-year criminal history if you have been in trouble in more than one location, just because that is a process in its own within that county, within that justice system. But once that has been all submitted, it's really just staying in contact with the board of, have you guys received my background check yet? Have you guys received my fingerprints yet? Just because they're so busy and backed up that if you're keeping in contact with them, it kind of keeps them on track of getting your application processed and it moving forward without being at a standstill for months. I'm currently going through the same process for my ACLC licensure. It's a little bit of the same thing. Some people are able to move forward without additional documents. Other times they will send out an email asking for additional documents. So
Very involved then.
very involved, yeah.
Right. And then are there certain, do you have to apply to be, how long does your certification last? You have to do any continuing education credits, or how long do you before you?
So every 20 hours, every 40 hours that you work is 2 hours of clinical supervision that you have to keep up on. You have to show proof if you get audited. You are required to get 20 additional CEUs a year in order to recertify. Your certification needs to be done every year. I think it has to be done by June.
Cierra, what does that clinical supervision entail? Is it just like something for you, or is it them monitoring?
So it's a little bit of both. Having a clinical supervisor as a peer is important, especially your clinical supervisor being outside of your own organization, because it's where you go to kind of debrief and talk about things that you're struggling with within your organization and having an outside perspective without causing conflict within your current employment. So my clinical supervisor is an LFT, LCFW, a doctor, and then I have a separate one who is just an LCSW, and I go to each of them for different things. I'll go to the LCSW as a group with my other peers so we can kind of debrief and kind of hash things out and see where each other are and how we can support each other. and then I'll go to my other clinical supervisor just as an individual to get kind of like my own trauma that's coming up, my own secondary trauma that's coming up from working with peers out. And she really helps me process my individual stuff. You don't have to have separate clinical supervision or supervisors, just because it is kind of hard to keep track of how many hours each person is seeing you, kind of thing. But then it is also required by the state to have that documentation that you are being monitored and are seeing somebody.
It sounds kind of like an important support. You were saying that you like doing that. It seems like to make sure that you're getting the support you need.
Absolutely. Honestly, I did just group clinical supervision for a while, and I found that although it was beneficial, I wasn't able to work through the things that I needed to work through on my own for my own stuff that was coming up. And so I talked to, my boss, and I was like, look, I have this stuff coming up. It's not really stuff that I feel comfortable talking about in a group because it has to do with my own clients and my own stuff that's coming up from working with these clients. I'm going to get another clinical supervisor just for me. Because if I'm not taking care of myself and my own mental health, how am I expected to benefit in another individual who's struggling? As even though we aren't clinical as peers, right? We still suffer from burnout. We still suffer from the secondary post-traumatic stress of helping individuals through their own traumatic experiences, that it is so important that we take care of ourselves to avoid the burnout, because we're addicts too. We have sustained recovery, but it is so easy for us to go back out and use if we're not taking care of ourselves.
Yeah, thank you. I appreciate your honest answer to that too. So I personally think that's so important to have your own supports just for everyday life. So I can't imagine um like the how cool it is that you advocated for yourself and like that you wanted someone else to talk to for personally too, because you knew you needed that support. So that was really cool.
Oh, absolutely.
And it looks like Emily Munn in chat said, thank you so much for saying this.
Yeah. I see I see a lot of individuals that work within this field relapse because they're not meeting with a clinical supervisor, and they stop doing the things that we originally did that got us to where we are today, right? Like, I am a recovering addict first before I am a peer. Before I am a licensed peer support under the state of Montana, I am a recovering addict, which means I still attend 12-step meetings. I just attend meetings that my clients don't go to because I'm not trying to trauma dump my stuff on them or talk about my stuff in a meeting where they might be like, oh, that's my peer. She can't be struggling right like this, right? So I find alternative meetings to kind of balance that out. I still work the 12 steps with a sponsor. I am still reaching out to another addict outside of my job every day and communicating with my team on, this is where I'm at today. Could you take this client? I just need a minute to really regroup myself. I'm not feeling okay today. And then I'll reach out to my clinical supervisor, like, this is where I'm at. And she'll give me a suggestion on what I can do to work through that so that I can get back on track with my clients. So, Christina, I am actually SOAR certified as well. So I am very familiar with SOAR and getting individuals through that process. So it is in my contract. And so now that I'm getting ready to leave NARSS the second week of June, it is required that our contract requires another peer to get SOAR certified. So it's a great resource. We use it a lot. So great questions.
Cierra, can you tell us what SOAR stands for?
No. Honestly, I know it as SOAR Works, which is it's a training that you can do to take people through the Social Security benefits and helping them get approved without the extra hassle of not having an address or not having a phone number. I don't understand what this looks like. Can you help me do this? Oh, Christina's got it for you.
Oh, there we go. Social Outreach Access and Recovery Program. Thank you. Well, amazing. Thank you so much, Cierra. Do you want to go to the next slide, Maynard? Are there any other questions? Sarah, really appreciate the fantastic presentation and what a journey and all your accomplishments. Wow, just incredible. We have a QR code for your feedback, and there's also a link in the chat. And we will continue this webinar series with our, hopefully you'll join us for our June presentation where April Seat will be our presenter, April's Cold Rescue Mission. But one last chance, any questions or comments for Cierra? All right, we'll give everybody back a few minutes in their day. And again, Cierra, thank you again.
Thanks for having me, Marcy.